Some encouraging news tonight for people who have Anthem health insurance in Maine and who get their health care from Northern Light Health.
The two companies have now agreed to extend current coverage for another 30 days so that they can then resume talks over a new contract.
Anthem covers about 30,000 Mainers, and in the interest of full disclosure, that includes the people who work right here at News Center, Maine. We have team coverage of this latest development, beginning with Alex Haskell in Augusta. Hey there, Alex.
Hey there, Brian and Amanda. So today, Anthem and Northern Light Health released a joint statement, and I want to go into what this statement says. So the two sides say their current contract has been extended for 30 days. So as of now, nothing has changed. Northern Light and medical providers will remain in network with Anthem employer-sponsored and individual health plans through October. Northern Light inpatient care and services from hospital outpatient departments will stay in network with Anthem employer-sponsored individual plans through December. And all Northern Light hospitals and physicians will remain in network for Anthem Medicare Advantage plans through December. Now, how did we get here? Want to explain that executives at the two companies have been unable to agree on basic details of the negotiations. Anthem leaders have stated Northern Light started talks by asking for a reimbursement increase of 30%, steadily growing over 3 years for its healthcare providers, and Northern Light denies this. So here in Augusta today, lawmakers were scheduled to be briefed this afternoon on the situation by Anthem and Northern Light representatives, but that briefing was postponed after lawmakers learned of this joint statement.
We, the committee, are encouraged by the progress thus far. This is a situation the committee will continue to monitor very closely, and we hope to hear about further progress in the very near future.
And we are learning tonight that Governor Janet Mills herself played a critical role in extending contract negotiations. Her office telling us that she spoke with both sides on this. And Brian and Amanda, she also encouraged them to stop putting Mainers' health care at risk and come to an agreement.
Alex Haskell live at the State House tonight, kicking off our team coverage on this big story. Alex, thank you. Meanwhile, financial battles between insurance companies and hospitals, nothing new.
There is a delicate balance of providing adequate care and keeping costs in check. News Center Maine's Drew Peters is also in Augusta tonight with more on that piece of things. Drew?
Representatives from both parties say this extension will give them the possibility to explore potential new contracts that will start and end at consistent dates, providing more clarity for patients. While this brings hope for many, leaders with the Maine Hospital Association say it's important to remember there's still about 30,000 Mainers whose insurance coverage hangs in the balance of these ongoing negotiations. These patients may be pushed to look for other insurance or healthcare providers throughout the state, but leaders with the association say the lack of options could leave many of them without coverage for some time.